Let's discuss time-critical emergency for burns. Burn injuries are among the most urgent and complex emergencies encountered in healthcare. They demand rapid assessment, precise clinical decision-making, and compassionate, trauma-informed care. Because burns can progress quickly, affecting airway stability, fluid balance, tissue integrity, and infection risk, early interventions often determine long-term outcomes. In emergency and acute care settings, nurses play a pivotal role, recognizing life-threatening complications, initiating evidence-based treatment, and providing reassurance during what is often one of the most frightening moments of a patient's life. Burn injuries can result from exposure to heat, electricity, chemicals, or radiation, and each mechanism carries its own pattern of tissue destruction and potential complications. Regardless of the cause, burns can rapidly progress, leading to significant damage to the skin and underlying structures. Early recognition and immediate first aid are essential to limit the depth of injury, reduce pain, and prevent further tissue loss. Prompt medical evaluation is equally critical, as timely interventions help minimize complications, such as fluid imbalance, airway compromise, and infection, one of the leading causes of morbidity in burn patients. Effective early care sets the foundation for improved healing, functional recovery, and long-term outcomes. Early warning signs of severe burns. Recognizing early indicators of a severe burn is essential for rapid intervention and preventing further tissue damage, extensive body surface involvement, and signs of systemic complications to enable rapid intervention and prevent further harm. Burns can range from minor to life-threatening, and warning signs include severe pain, blistering, leathery or charred skin, swelling, and involvement of sensitive areas like the face, hands, or genitals. Key warning signs includes redness with intense persistent pain, may indicate deeper dermal involvement. Blister formation suggests partial thickness injury and increases infection risk. Swelling of the affected area reflects inflammatory response and potential progression of burn depth. Charred, leathery, or white skin, a hallmark of full-thickness burns requiring urgent medical care. And difficulty breathing, in inhalation burns, signals airway compromise from heat, smoke, or toxic fumes, and is a medical emergency. It causes airway edema, which is swelling of the tissues lining the upper and lower airway. Smoke particles are inhaled deep into the airway and lungs, where they adhere to the moist lining of the respiratory tract. Smoke particles cause bronchospasm by directly irritating and inflaming the lower airways. During a fire, smoke contains carbon particles, ash, and toxic debris. When these materials are inhaled, they settle along the airway lining. High-risk patients in burn emergencies. Certain populations are at increased risk for severe complications following burn injuries and require rapid assessment and early escalation of care. These high-risk patients may experience faster fluid loss, impaired healing, increased infection risk, and higher mortality rates if treatment is delayed. Prompt identification and aggressive management are critical to improving outcomes. High-risk populations include children and older adults, more susceptible to fluid loss, hypothermia, and deeper tissue injury due to thinner skin and limited physiological reserves. Patients with large surface area burns, at increased risk for shock, infection, and metabolic complications, often require specialized burn center management. Patients with extensive burns, often greater than 20 to 30% total body surface area, depending on age and comorbidities, experience system-wide physiological failure, not just a skin injury. Critical care is required because multiple life-sustaining functions are immediately threatened. Electrical or chemical burn victims. These mechanisms can cause hidden internal damage, cardiac complications, or ongoing tissue destruction. Electrical burns are often more severe than they initially appear, because the electrical current travels through the body, damaging tissues along its path, not just the skin surface. External burns may be small, but internal injuries can be extensive. Major complications includes cardiac dysrhythmias are the most life-threatening risk. Electrical current can disrupt heart rhythm immediately or up to 48 hours post-injury, requiring continuous ECG monitoring. And neurologic injuries or nerve damage, seizures, paralysis, peripheral neuropathy, may be delayed and worsen over time. A chemical burn occurs when skin, eyes, or mucous membranes come into contact with a corrosive substance, most commonly acids or alkalis, bases. Unlike thermal burns, chemical burns can continue to cause tissue damage until the chemical is fully removed or inactivated, making early recognition and intervention critical. Major complications include skin damage, which can cause progressive tissue destruction, loss of skin layers, scarring and contractures, delayed wound healing and increased risk of infection, and respiratory injury, which causes airway inflammation and edema, chemical inhalation injury, and hypoxia and respiratory compromise. Patients with inhalation injury is high risk for airway damage that causes airway edema, burns, and ulceration, and can cause soot deposits, which is made of tiny particles from burned materials, wood, plastic, fabric, etc. When inhaled, these particles can stick to the nose, mouth, throat, and lungs, travel deep into the respiratory tract, and carry toxic chemicals with them. Chemicals can lead to inhalation injuries by releasing toxic gases, including carbon monoxide and cyanide. Patients with inhalation injuries develop lung damage that leads to bronchospasm, inflammation, and pulmonary edema. When someone has an inhalation injury, the risk of respiratory distress can increase quickly, sometimes within hours, so airway management is critical and often urgent. Rule of Nines. Rapid TBSA estimation. The rule of nines is a quick, widely used method in emergency care to estimate the total body surface area, TBSA, affected by burns. It divides the adult body into regions that represent 9%, or multiples of 9%, of TBSA, allowing clinicians to rapidly gauge burn severity and guide early management. This method is especially valuable during initial triage and fluid resuscitation planning. Why it matters. It determines burn severity and need for specialized burn center referral. Guides fluid resuscitation, particularly when using formulas such as the Parkland formula, and supports early clinical decisions, including airway management, monitoring, and transfer planning. The rule of nines divides the adult body into regions that represent predictable percentages of total body surface area, TBSA. This helps clinicians rapidly estimate burn size and guide early management decisions. Adult TBSA breakdown, head and neck, 9%. Each arm, 9%. Anterior chest and abdomen, 18%. Posterior back and buttocks, 18%. Each leg, 18%. Perineum/genital area, 1%. While fast and practical, the rule of nines is less precise in children due to different body surface proportions. In those cases, the London-Browder chart provides more accurate age-adjusted estimates. The London-Browder chart is the most accurate age-adjusted tool for calculating burn size, TBSA%, especially in children, because it accounts for how body surface proportions change with age. It's considered the gold standard in burn assessment and is used to guide fluid resuscitation, triage, and overall management. London-Browder chart give the most accurate. It adjusts for age, ideal for pediatrics. Limitations is it takes slightly longer to complete. While the rule of nines is fast and simple, especially in emergent cases, but less accurate in children and obese patients. The Palmar method is good for small or patchy burns, but not ideal for large burns. Why the rule of nines matters. Understanding TBSA using the rule of nines is essential in early burn management because it helps estimate burn severity, supports quick classification into minor, moderate, or major burns, guides fluid resuscitation, Parkland formula. Accurate TBSA estimation ensures appropriate fluid replacement during the critical first 24 hours, assists in triage and referral to burn centers, determines whether the patient meets criteria for specialized burn center care, supports documentation and ongoing monitorings, provides a baseline for tracking progression, healing, and response to treatment. When to seek urgent care and immediate first aid. Burns involving more than 10 to 15% total body surface area, TBSA, require urgent medical attention due to the high risk of fluid loss, shock, and complications. Early fluid management and rapid assessment are essential to stabilize the patient and prevent deterioration. Immediate burn first aid. Cool the burn under cool running water for 10 to 20 minutes to stop thermal injury progression or limit further tissue damage. Avoid ice or ice water can worsen tissue damage and cause vasoconstriction. Next, cover the area with a clean, sterile, non-adhesive dressing to protect the wound and reduce infection risk. Burns compromise the skin's protective barrier, increasing the risk for infection. Covering the burn with a sterile, non-adherent dressing protects exposed tissue, reduces contamination, and prevents further mechanical trauma during movement or dressing changes. Seek prompt medical care for moderate to severe burns, including large TBSA involvement, electrical or chemical burns, or any signs of airway compromise. Moderate to severe burns can rapidly become life-threatening due to fluid shifts, infection risk, and potential airway compromise. Electrical and chemical burns often cause deep tissue damage that is not immediately visible, and airway involvement can lead to acute respiratory obstruction, requiring prompt advanced medical intervention. Early, appropriate first aid significantly improves outcomes by reducing burn depth, controlling pain, and preventing complications. Appropriate first aid is critical in burn management because burn injuries can continue to progress after the initial insult. Prompt intervention helps stop ongoing tissue damage, limits burn depth, and preserves surrounding viable tissue, which is essential for improving long-term outcomes. Timely first aid also reduces pain and physiologic stress. By quickly addressing the source of injury and stabilizing the affected area, early interventions help decrease pain and prevent the release of inflammatory mediators that contribute to worsening tissue injury. Early intervention reduces the risk for complications. Limiting burn depth decreases the likelihood of infection, fluid imbalance, impaired wound healing, and other life-threatening complications commonly associated with burn injuries. Critical priorities in emergency burn management. In emergency care, early fluid resuscitation and infection prevention are essential to survival. Significant burns can lead to rapid fluid loss, shock, and impaired tissue perfusion, making timely fluid replacement a cornerstone of initial management. At the same time, the loss of the skin barrier places patients at high risk for infection, which is a major cause of morbidity in burn injuries. Immediate priorities focus on rapid fluid resuscitation to prevent hypovolemic shock, early infection prevention to reduce risk of sepsis, airway protection in patients with facial or inhalation burns, pain control and temperature regulation to support physiologic stability. Key point focuses on prompt, evidence-based interventions in the first hours after injury significantly improve survival outcomes. Skilled nursing care during the first hours shapes the patient's entire recovery journey. The nurse's impact in burn care includes rapid assessment prevents complications, early interventions reduce mortality, compassionate care supports healing and trust. When in doubt, treat burns as life-threatening emergencies. If you learned something today, share this video. It might help save someone's life. Awareness is powerful, and together, we can prevent burn injuries before they happen.